Okay, our discussion topic today is epilepsy. And the things that we'll be talking about is first off, what is epilepsy? What causes it? How is it treated? And can epilepsy be avoided? So, our overall review of what we're having to talk about today is again, what is epilepsy? Facts about epilepsies and seizures. We'll talk about the symptoms, the different types of seizures, the causes of epilepsy, how it's diagnosed, how it's treated, and of course, we'll talk a little bit more in detail about medications and diet. And is epilepsy preventable? And then we're going to just provide you some resources for those individuals who have epilepsy who need additional information. So let's jump right in. So, what is epilepsy? Well, first off, it is a chronic neurologic disorder that is characterized by unprovoked seizures. Depending on the type of seizure, it can last for as short as just a few seconds or as long as a few minutes. And the manifestation as to why these seizures are occurring or where they're occurring in the brain can vary. These seizures are generally going to be sudden, and it is an abnormal electrical discharge in the brain that causes these symptoms to occur. So, what does this mean in English? Well, your brain is made up of billions of cells called neurons. And these neurons communicate using electrical and chemical signals to help to control how the body functions. So seizures can happen when these electrical and chemical signals are not working the way they're supposed to normally. So what it is an irregular electrical impulse in the brain. That is what a seizure actually is. It's like an engine that is misfiring, if you will. So let's talk about some facts about epilepsy and seizures. Not all seizures result in epilepsy. A seizure is a single episode, while epilepsy in itself is a disease involving unprovoked seizures over time. A single seizure does not necessarily mean that an individual has epilepsy. And there are two major categories of seizures that occur. One, a partial onset seizure or a generalized seizure. And I'll go into more detail. First off, looking at the types of seizures, it tells you that a partial onset seizure occurs in one area of the brain, and that's where the activity exists. A generalized seizure, on the other hand, is occurring in more than one hemisphere of the brain. So there are multiple areas that are misfiring that is causing the actual seizure. So when we talk about a partial onset seizure, known as like a focal seizure, this happens when one area of the brain is affected. And according to the National Institute of Neurologic Disorders and Stroke, about 60% of the people with epilepsy experience partial onset seizures. And these include a simple partial seizure, which don't impair the consciousness of the individual and can cause twitching or a sense of change in odor or smell, and it's not actually there. So it's like individuals will say, "Do you smell something burning?" And no one else smells that but that individual. That can be a clue to them, or an aura, if you will, that a seizure is occurring. It can be an uneasy stomach sensation, which is very common. Now, complex partial seizures, on the other hand, impair consciousness. So a person may appear dizzy or confused, even unable to respond to others for a few minutes. Secondarily, generalized partial seizures occur when a partial seizure spreads to both sides of the brain. And that's when it becomes a generalized seizure. So the difference between the two, a partial onset seizure occurs in one area of the brain, and it can move from being a partial seizure to a general seizure if more than one area of the brain is then affected. So generalized seizures, as I just indicated, it's a seizure that occurs when this electrical misfiring occurs on both sides of the brain. Some examples include absence seizures, also known as petit mal seizures, which cause rapid blinking or staring into space. Tonic-clonic seizures, known as grand mal seizures, which can cause involuntary crying out, loss of consciousness, falling, convulsive muscle spasms or jerks. This is the type of seizure most people picture when we talk about seizures themselves. But absence seizures can occur with epilepsy just like a generalized seizure can occur. So, what are the symptoms of seizures? Well, it can range from the rapid blinking and staring that I just talked about at, nothing particular they're looking at, or a loss of consciousness, falling, muscle jerks. Partial seizures are the most common type of seizures that people with epilepsy experience. Um, for many, almost any movement, sensation, or emotional symptom can occur as part of this seizure activity. And so it tends to affect part of the visual and auditory sensations, which can result in hallucinations. As a result, there can be a variety of symptoms from person to person, depending upon what part of the brain is involved. These symptoms can often reflect what part of the brain is being affected because of the type of activity that occurs with the seizure. For example, one person may experience a seizure and remain alert and aware, be able to respond to others, and remember everything that's happening, while others lose awareness and become unresponsive. So again, it depends on where in the brain that the seizure is occurring. Now, some of the partial seizure symptoms are strange or unusual sensations, like the smells or taste of something that really isn't even there, pins and needles or electrical sensations throughout the body, strange smell or taste, and it's usually something that's either taste or smell like chemicals or metallic or is often very, very unpleasant. It's never something like, I smell chocolate. No, it's, I smell burning wood, or I smell metal, or I smell uh, ammonia, or something to that nature. There can be visual abnormalities, such as flashing lights, complex scenes that are not necessarily there, but seem visual to the individual. There can be hearing complications, such as buzzing sounds or a person's voice coming in and out, becoming louder or quieter when the conversation is actually at a single tone. Sudden or restless movements, like stiffening or twitching or jerking. You can have altered heart or breathing rates with these seizures. You can have sweating, dreaming, or having that out of body feeling. You can have an altered sense of time, as though you have traveled to a different era or time, or you lose track of time. And we're talking significant amounts of time. You can have stomach or chest discomfort, or that sudden feeling or sense of fear or anxiety. All of these can be symptoms of partial seizures. Now, a complex partial seizure generally occurs when there is a loss of consciousness. The person can appear dazed or confused. They're staring off into space. They may be randomly walking, wandering, if you will. They may be mumbling. They may have head turning inappropriately, grunting or repeating words or phrases, lip smacking, chewing, swallowing, pulling or picking at their clothes, or shuffling as though they're shuffling cards. They're moving their hands like they're dealing cards or shuffling. And it's involuntary. It's not something that they are doing with intention. It's something that is just occurring. Now, a person experiencing these kinds of symptoms will not likely be able to respond to questions or direct instructions. After the seizure has ceased, the person may be confused for several minutes and may experience a few hours of fatigue. After the seizure, the person will be unable to recall what happened during the seizure. And on the whole, partial seizures last anywhere from about 30 seconds to about 2 minutes. While these partial seizures can affect different physical, emotional, or sensory functions of the brain, they can have different symptoms and some things that are in common and others that are not. One, they don't generally last for longer than that 2 minute to 30-second interval. They usually recover fully. The individual usually recovers fully after the seizure. And in most cases, those seizures end naturally. And it's something that's important for people to know and understand. You can't stop the seizure while the seizure is happening. What you should be doing is making sure that the individual is in a safe environment where they are not receiving additional harm by objects being in the way. They need to make sure that they are in an area where the there's something soft to cushion them if they're having the jerking movement, that their airway is patent, or that they have the ability to breathe. So these are the things that you can do, but trying to hold down or restrain an individual having a seizure does not help. Okay. So it's important that we know the symptoms. Knowing the personal symptoms of the individual with the seizure disorder can help better communicate to a physician or to a healthcare provider what is actually happening with that individual. Being aware of the typical syndromes can help you educate other people. If you're an individual that has seizures, you can inform them. If I'm just staring off into space and my lips are smacking and my hands are moving as though I'm dealing cards, I am having a seizure and I will need assistance. So they can be aware of what to expect if you have a seizure in their company. It may also help to determine if there are changes in your symptoms, because those symptoms can change. If a seizure generally occurs in one part of the brain, which creates specific symptoms, and then the next seizure is in an entirely different part of the brain, the symptoms may be very different. So it's important that you communicate what you know about seizures and what may be some of the symptoms that affect you. So some of the common triggers for these seizures can be alcohol or drug use, certain foods, such as excessive amounts of caffeine or other products that may aggravate seizures, such as energy drinks. Dehydration can trigger seizures. Emotional stress, such as worry, anxiety, and anger. Fear or other illnesses can trigger seizures. Unpredictable changes in the metabolic factors like vomiting, diarrhea, and physical stress can also bring on seizure activity. Flashing bright lights or other visual stimulation like computer games, video games can also commonly trigger these seizures. Hormonal changes can trigger seizures, such as those that occur during a woman's menstrual cycle. Missing or skipping meals or having low blood sugar can lead to seizure activity. Sleep deprivation overtired, or not sleeping well can lead to activating or triggering these seizures. It's important that you educate yourself about seizures and be aware of the personal triggers that you may experience and the symptoms that are key to your seizure management. So, is epilepsy common? Well, in doing some research, we found that epilepsy is more common than most people think it is. It is the fourth most common neurologic disorder in the United States, and over 2 million people in the US have been diagnosed with epilepsy. 1 in 26 Americans will be diagnosed with epilepsy at some point in their lives, and about 60% of the people that have been diagnosed with epilepsy are going to have partial onset seizures. The other 40% would have those generalized seizures. So, what causes epilepsy? Well, the actual cause of epilepsy is unknown in the majority of people that have it. According to the CDC, um, it may be a cryogenic or an idiopathic epilepsy. Idiopathic means the cause is unknown. For others, the cause of their epilepsy is clear. It can be a traumatic brain injury or a head injury, brain tumors, birth defects, or even strokes. These can all initiate or trigger those seizures, and they are the cause behind the disease for those individuals. The different causes of what happens at different stages of life. A birth defect or a brain injury can lead to seizures. A mutation in genes may lead to specific childhood epilepsy syndromes. Head trauma or certain infectious diseases such as viral encephalopathy or viral encephalitis can disrupt the abnormal brain activity, and this can lead to changes in the electrical transmission in the brain, which then, of course, then makes seizures more likely. Conditions that deprive the brain of oxygen, such as strokes, heart attacks, and are some of the common causes of epilepsy in our elderly population. So, how is epilepsy diagnosed? It's important for a doctor to understand the cause of your seizures so they can identify the type of epilepsy that you have and the best treatment for you as an individual. Be sure to talk with your healthcare provider who's going to take a look at the cause. They're going to look at what prescription medications you are on, if you are prescribed an anti-seizure medication or other treatments needed. They're going to answer your questions about epilepsy, and they're going to refer you to an epilepsy specialist if needed. To diagnose epilepsy, your caregiver or your care professional will review your symptoms and your medical history. They may have you take several tests to diagnose epilepsy and to determine the cause of the seizures. Diagnosing may include a neurologic exam, and this is the exam or the test that tests your behavior, your movement, your mental function, and other areas of the brain. The test will help to diagnose epilepsy, including the type of epilepsy that you may have. Blood tests are done. A blood sample, it can be detecting the signs of infection, genetic conditions, or other conditions that might be linked to seizures. That genetic testing, well, in some people with epilepsy, genetic testing may give them more information about the condition itself and how to treat it. Genetic testing is most often performed in children, but may also be helpful in some adults with epilepsy. So you've also have to have brain imaging to detect areas of defect in the brains or changes in brain activity. That's an electroencephalogram or an EEG, And this is the most common used test to diagnose epilepsy. In this test, a small metal disc called electrodes are attached to the scalp with an adhesive cap, and then these electrodes record the electrical activity of the brain. So that way they can tell if there are irregular electrical impulses that are occurring. So, how do we treat epilepsy? Well, by far, the biggest treatment for epilepsy is medications. Many people are able to control their seizures on one anti-epileptic medication. But when the seizures become managed on one medication alone, when they're not managed on one medication alone, the individual may end up on more than one medications. Surgery is a treatment. When seizures come from a single area of the brain, surgery might be helpful. Removing the affected area may stop further seizures or even make them easier to control with medication. There are seizure devices such as a vagus nerve stimulator, and this is an electrical device that is placed under the skin on the upper chest. It sends energy pulses to the brain through the vagus nerve, and this can stop the seizures. But this isn't something that is done, frequently or without uh, proper guidance. Responsive nerve stimulation. This is an electrical device it's placed in the brain to find the area where the seizures are coming from. Then when it sends these energy pulses to that area, it helps to quiet that irregular impulse in the brain. So what's happening is it's kind of like sending a rocket to change the trajectory of another rocket or to explode that rocket or to manage the impact of that rocket. So what happens is when that electrical device is placed in the brain and the person has a seizure, there are electrical impulses that are sent by this device that helps to make the seizures subside. And last but not least, diet can help with seizure activity. If medication doesn't work and surgery isn't an option, there are other treatments that might help you. One of those suggestions is a ketogenic diet. This is a strict diet with high fat, low to no carb. It's typically used in children who's had seizures without stopping them, and it's prescribed by healthcare providers. It's still prescription, but you can get it over the counter. These are all ways that we treat epilepsy. Now, there may be a combination of things that are done for treatment. You may be on diet and exercise. You could be on some of the other forms of seizures that are occurring with epilepsy. And the job of this device, this focal seizure, is to help adapt and to help to maintain and control the seizure activity. So these are the treatment options we just talked about: anti-seizure drugs, having surgery, the vagus nerve, deep brain stimulation, and diet. I know. Either I got to swallow something, eat something, or get poked somewhere. But those are the treatment options that are available. And it's important that individuals that have epilepsy know exactly what their options are in regards to how they choose to be treated with this disorder. So, medications, controlling seizures with meds, turning to an add-on therapy will sometimes help individuals with epilepsy. Some people will continue to have seizures even though they're taking an anti-epileptic drug. When one medication is not enough to control the partial onset seizures, your doctor may recommend an add-on medication that will also help to assist. These are called adjunctive therapy. An adjunctive therapy anti-epileptic medication is added to your current treatment of one or more anti-epileptic medicines and may be able to provide additional support to cause the decrease or cessation of these seizures. Studies suggest about 50% of the patients will need an additional anti-epileptic drug after their first medication. What they're saying there is, for the most part, most people don't end up on one medicine. It's usually two medications at least to help to control the seizure activity. Taking your time back from seizures may mean working with your doctor to find the combination of anti-epileptic medicines that work for you. If you are still interested in partial onset seizures and what to do about them, you can contact your doctor to obtain more information on treatment options. So diet, a ketogenic diet. Some children and some adults with epilepsy reduce their seizures by following a diet high in fat and low in carbs. They may be they may have an option when these medications aren't managing the epilepsy alone. Basically, what they're saying is it may take more than one med to find out what works with you for your epilepsy. And in the case of talking about cryogenic medications and ketogenic diets and how to go about staying with the diet, it's important that you understand that this diet is designed to break down fat instead of carbohydrates for energy. After a few years, some children have been able to stop the ketogenic diet and remain seizure-free. It's important for this to be done under close supervision of a healthcare worker. There shouldn't be anybody that just stops their ketogenic diet. Okay. Following the ketogenic diet can be hard. Low glycemic index and modified Atkins diets often help to restrict or to alter that seizure activity and can provide some improvement for those seizures. There's some correlation between ingestion of fats, especially healthy fats, and the electrical impulses in the brain. I just don't have that study information to be able to provide that to you. But what kind of providers are there out there that treat epilepsy? Well, a neurologist can be an individual who specializes in the diseases of the brain, spinal cord, and muscles, and is trained to investigate or diagnose and treat neurological problems. An epileptologist, is a neurologist who specializes in the treatment of epilepsy. So they are a neurologist, but has a more in-depth understanding and knowledge base of seizure activity or epilepsy itself. So is epilepsy preventable or avoidable? Well, while it cannot be prevented, being alert and taking some of these precautions helps people in controlling the epilepsy itself. 1, avoid head injury. 2, make sure that you're getting perinatal care. 3, stop smoking. I think in every class, I think that's one of the things we emphasize. You don't need to do anything else for your body with the smoking. We want to have a proper sleep and a proper sleep pattern. If your sleep pattern is you take a nap at 6 p.m. and then you don't go to bed till 1 a.m., you have to consider that individual's sleeping time and how much of it they're actually obtaining. Perinatal care. The perinatal care is vitally important. You want to make sure that during the pregnancy that you are taking your vitamins, getting proper exercise, eating the proper foods, and doing what your provider has told you to do to maintain a healthy pregnancy and a healthy baby. Eliminating the brain parasites. That sounds a little weird, but we all have parasites, and they tend to live on our bodies or on our skin or whatever the case may be. But these parasites can also stimulate the activity of the brain to cause it to misfire, if you will. Okay. Indulging in stress-free activities will help prevent epilepsy. Uh, stress-free activities include things like kayaking or boating or fishing, things of those natures. Being active in general helps to improve the health and welfare and well-being of an individual with epilepsy. And of course, maintaining a proper diet. So when we talk about coping and supporting, some people who experience seizures have depression. Some people alienate themselves. But what's important is that they understand the difference between normal activity, abnormal activities in the body, so they can interpret the body's signals to learn to cope with the disease and to be alert to oncoming seizures. In coping and supporting, it's important that you educate yourself and your friends and family so they understand what's going on. Try not to engage in negative reactions from people. Try to ignore those. It helps to learn about epilepsy so you know what to do and you learn the facts as opposed to misconceptions of other individuals that don't have the disease. Try to keep your sense of humor. You know, you have to laugh when things happen. And it's always been said laughter is the best medicine. Well, in this case, laughter does help. Having humor. Live as independently as possible. There are some people who have, from epilepsy, been unable to prepare a lunch for themselves or dinner or to get through washing the clothes or even cognitive realizing you got that to do. So you want to find a healthcare provider that you like and with whom will deliver you the best care and that you feel comfortable with. And you have to not leave here panicked about your seizures. There's some things that you can use for support to help you to better understand and control the disease. So resources. What resources are available to individuals with epilepsy? Well, there is the Epilepsy Foundation, which is a nonprofit organization dedicated to help epileptics through efforts including education, advocacy, and research to accelerate ideas into therapies. That would definitely help. Next is our canine assistance. It's a non-profit organization that trains and then provides the service dogs to individuals with seizures. And if you need assistance with obtaining a service dog, the number is 1-800-771-7221, and that's called Canine Assistance. There are other assistance programs here in town, but we don't want you using the emergency room like a clinic or a rotating device or organization. So one of the things that the medical alert company has suggested is medical alert bracelets be worn, or a way of notifying another individual that you have seizure disorder. If you have a seizure, it makes it much easier to be treated and for people to know what's going on if you wear something that indicates that you have seizure disorder. These bracelets and necklaces are nonprofit, and it's important for people to have a sense of safety, especially for family members. You know, if you're out doing something and all of a sudden you lose consciousness, you're going to hit the ground. Or if you're semi-conscious and you decide, I don't need help, I'm just going to walk home the rest of the way, and the home is 8 miles away in the hot sun, that could create more seizures. And so it's important that we recognize those I'm going to say $5. Those $5 tidbits I just gave you, along with the information on certain things to do. In my convulsive medication, there is a book that was written that talks about, I can't remember the athlete's name, but he's an athlete. And the North American AED Pregnancy also helped to sponsor this book. Now, the AED has developed another organization that helps people with epilepsy, and they have paired with the hospitals in an area, and it's called Is My Convulsion Medication Safe During Pregnancy? And that's where we learned. We had a case in 1977. I was still in high school at the time, but a young lady who was not married, but that co-lived with an individual, and this individual continued to have seizures. And it wasn't until the individual started wearing a medic alert bracelet and to let people know what was going on, did she actually get the kinds of responses that she needed, because people didn't know what was wrong. I think I skipped Canine Assistance. The Canine Assistance Program is an organization that trains and provides service dogs to enhance and improve the lives of people with disabilities. Seizure conditions such as epilepsy or other special need conditions do qualify for this program, and we've given you the phone number for that already. When we talk about the AED pregnancy register, this is an anticonvulsive safety measure that is often asked, is my anticonvulsant medication safe during pregnancy? Well, the American AED pregnancy registry is dedicated to answering this question. Anticonvulsive treatments or disorders like epilepsy, mood disorders, chronic pain, they have answers for each of those because there's specific criteria based on the individual's condition, the trimester of pregnancy, and things of that nature. So it's a registry that provides information, and we have the phone number for them there as well as their website. And so if there are questions related to seizure activity and pregnancy, those are going to be good resources for you. So that would really conclude our discussion about epilepsy. I know we didn't go into a lot of detail about epilepsy in children, and that we would probably do as a separate discussion because there's some differences in regards to how that's treated, what medications are on, and it may even be different in regards to some of the symptoms that we see with children. So at this time, I will open up the floor for questions. You can either type those in the chat or take yourself off of mute and ask the question. Do we have any questions? Like I said, this was a rather short presentation today, and again, we will be addressing uh, epilepsy in children in a separate discussion.
Okay. Doesn't look like there's any questions.
Okay, well, if not, again, thank you for attending. Thank you for your time, and we look forward to future discussions with you.